Can you all hear me okay? Perfect. Okay. So yeah, thank you for the introduction. Thank you for inviting me as well. So happy to be here to talk about AI tools in neurology and how these can apply both to research and to the clinical setting. So a couple disclosures. First, just from research and consulting and other things, there's some more information there, but nothing that is relevant specifically for today. Um, I will say, I thought a little bit about doing an experiment where I would do like half of my talk and have the AI make it, and then half of it that I made, and then see which one was better. But I promise I did not use AI to make any of this talk. So except for the parts that are specifically disclosed. So I think our goals are really to review just some really basic principles of AI, and then to discuss how AI tools are impacting medical practice with a specific focus on MS. And so we're going to talk a little bit about improving diagnostic accuracy. We're going to talk about how this might help with treatment selection. We're going to talk about patient communications, clinician burnout, and then some specific tools that those of you that are followed here as patients might be interacting with in an increasing way, whether that's from your Epic messaging with your doctors or with your MRIs. So those of you that are my patients, a lot of times we've taken a look at these, but we can walk through that a little bit. And then we'll talk a little bit about clinical research, which I think is really exciting forefront for AI. So I think one important concept is just to provide like a 30,000 foot overview of what is artificial intelligence or AI. And so AI is computer systems that are designed to perform tasks that traditionally have required human intelligence. So examples that a lot of people might be familiar with are like speech recognition programs or things like translation. So some of the earliest like AI tools that were really around were those of you that have used like Google Translate to try to simplify translations for things like Spanish to English and vice versa. So it really is an umbrella term, and there's a whole bunch of different methodologies that live, under the AI umbrella, just based on exactly what the mechanics are of how the computer system is working. So we're not going to get a whole bunch into that because it can be quite confusing. But you'll hear these terms sometimes used synonymously with AI, and so those are things like machine learning, deep learning, or natural language processing, also called NLP. And so you probably have seen a whole bunch of different media coverage about AI having a ton of promise to do things all over the economy and in every aspect of daily life. And then we think that that same promise, hopefully applies to medicine and to MS. How many of you have used an AI tool before, like ChatGPT or Google AI or anything like that? So quite a few. And probably have used it for a range of things, picking a restaurant, proofreading a document. So there's a ton of different ways that this can come to be. So this is a very simplified view of how AI works, but I think it can help us understand some of the limitations that exist. And so with AI, it is always initially fed data to basically train it. So in some respects, the limitation is that we have to have good data that goes into the system, or what it learns in order to produce a model might not be accurate. And so every program is a little bit different as far as what is included. We'll mention a couple of these later, but there's a few very specific like medicine related AI programs like Open Evidence that are often a little bit more restricted, but have much better vetted resources. So like medical journals. And then if you ever go into sort of the weeds with ChatGPT, you'll see that sometimes it's been trained on Reddit and like other forums that are not as well vetted as far as being a good quality control metric. So you're also asked on some of these to provide feedback about the answers. So does the uh, uh, does the answer that you get satisfy like what you were looking for? So that's important. And there's different limitations with this as well as far as processing speed. So you'll see a lot of concerns at different points about AI and even impact on like the power grid with data centers and processing chips and things like that, where it just becomes sometimes hard to get this all the way through. And so really these all end up producing a model, and then the AI will produce some sort of output for us, and we hope that that is ultimately helpful. So there's quite a few potential benefits to AI. So it can be very good at repeatable tasks that where people run through the same situation as far as being able to create an output. So there's been some concerns with like more simple employment positions that there may be job loss for like data processing and things like that if the AI can do it more efficiently. We may be able to have some other benefits, including things like personalization, just based on the AI picking up on factors that may benefit you. There may be improved decision making, which is one thing that we'll talk about specifically with medicine, about can we use AI to help us not make mistakes. And then we may also just be able to use AI in more of this generative capacity. Can we use AI to make diagrams or create text and things like that that might allow us to more efficiently accomplish tasks. As you can imagine, there's downsides to that as well. So sometimes the AI can make things that are fake. So you probably have seen various exposés in the New York Times or other places that have done this, like making like fake political videos, like things called deep fakes, for example. And so that can be a real concern. These same concerns apply directly to healthcare. We'll talk through one study about specifically trying to use AI to diagnose MS. So there's a concern that AI can, certainly be accurate, but it may be inaccurate, and if we rely on it too heavily, it may put us in the wrong position. There's concerns about reduced human interaction. So we'll talk through some situations in clinic where the AI might be used more, but it comes at the expense of having that personal connection, which I think is the same thing that we sort of have encountered just with the use of technology a lot of times in general, which leads into the next point. As far as technology dependence, and then we may not have as much oversight of this as we want as well. So some things to keep in mind that this has a lot of promise, but we have to be careful about exactly how we are using it. So this paper from earlier this year picked a few specific areas as to how AI might be specifically helpful for MS. And these really are an extension of what was mentioned just as far as AI opportunities in medicine on the previous slide. So one, of course, would be where, MS is typically starting as far as can we use AI to help with diagnosis or with treatment monitoring. So we'll talk specifically about MRI, as I had mentioned a little bit later. But there's a thought that AI might be more able to pick up on patterns consistent with MS earlier. So for those of you that are patients that had a sort of a long journey to diagnosis, if we were able to feed some of those clues into the AI system, would it be able to recognize just based on patterns of hundreds of thousands of clinical stories, pick up who might ultimately be formally diagnosed with MS at an earlier time point? We'll mention a little bit about modeling as well. So there's a thought, especially for progressive MS, that we often struggle to have objective biomarkers, meaning that patients are often coming in and feeling that they are having symptoms that are getting worse, and we keep checking all these tests. We can't really find anything that looks different, although we certainly believe the patient. It's hard for us to track. And so there's, again, a thought that the AI may be able to leverage this large data processing to pick up on patterns that allow us to track progression a little bit more easily. There's a thought about drug discovery. So could we use AI to model interactions with different compounds or pick up on things that might help us find drugs easier? Similarly, with personalized medicine, can we help better select treatments for patients based on factors that are hard to find just in the original data set? And then for lab research as well, there's some specific ways that AI might be helpful to us. So I wanted to just give a couple examples about things that I've used AI for in the past, just sort of separate from the clinical software setting. So we'll run through a little bit of that. But these are probably the most common tools that come up for us. So ChatGPT is a pretty broadly accessible tool. So a lot of you that had raised your hands that you've used AI have probably interacted with ChatGPT either on a browser or on your phone in different fashions. But we have two more clinically focused AI tools. So one was the one that I mentioned called Open Evidence, but Doximity is also a very common AI tool that we will use. So just as an example, I wanted to put an example of using ChatGPT to try to make sure that we're not, missing a diagnosis of MS. So, let's say I saw a clinic patient and I was like, hey, I should, put this information into ChatGPT about some key points of their presentation just to make sure that I'm not missing thinking about anything. And I think this is where AI is often extremely valuable for us. So over there on the left in ChatGPT, I wrote down to create a differential diagnosis, so a list of diseases to be worried about if a patient comes in with a spinal cord lesion, an optic neuritis, and a spinal fluid that has the oligoclonal bands. And then I put this in. I had AI spit out about a minute later this table about what diseases to consider, and then why they were worried about it, and then how I may want to help diagnose things. And so I personally thought the AI really did a great job on this one. So, I put in a story that was really concerning for MS, and I put MS right at the top. It explained very well why that was the case over in that clues pattern. And it recommended a couple things for me to do to help confirm the diagnosis. So I think this is really nice, both as a validation, but then also for us to think about, some rare things that we would not see as much. So if you look down at rank number 5, something like Sjogren's disease, that would be very uncommon to cause this, but it's certainly possible. So we always just want to have these things in the back of our mind. So I thought AI is pretty cool from that standpoint. And it's very fast. Like I personally, I pay like, I think it's $30 a month for the upgraded ChatGPT. There's a more expensive one that's like several $1,000s, but you can basically use it like a limitless amount of times and it's very fast. So it's a nice tool. So there's been, in this context, a little bit of emerging evidence on how accurate are these tools, and then how efficient are they. So this was a study from a group in Dallas at the UT Southwestern MS Center, and they basically turned a lot of clinic notes into little scripts where they could say like, I'm a 27-year-old man presenting with optic neuritis, create a differential, and then they would iteratively add different information. And the idea was to look like, how quickly would the patient be diagnosed and how accurately compared to what actually happened in real life. And so the ChatGPT was actually did pretty well in this study, but I think there's a number of important things to mention that we do not entirely understand. Is that it seemed to be quite biased as far as potentially missing diagnoses in certain groups. So there's a lot of work here to sort of understand why that would be the case. Are those patients just more difficult to diagnose? Is there something about the interaction with the AI or how it's trained that it might not be as good at picking up on certain things? But I think we'll know a lot more as these tools are used, just about how to better use them and potentially more specifically set them up to work well from an MS standpoint specifically. So in addition to diagnosis, we can also use ChatGPT for management. And so this was another query that I put in, and I wrote, which headache medications, just because that's a common, symptom in patients with MS, may be best to reduce migraine risk. And then I asked it to dig a little bit deeper. I said, please identify at least 3 peer-reviewed publications, just out of that thought that sometimes the AI is pulling data from things that are not really validated, and then provide a summary. So it very nicely, in just a couple minutes, produced this for me, where it selected a couple different classes of medications over on the right, provided a couple sentences of how that might be helpful. And then perhaps most importantly, at least for me, down at the very end of each figure, it has a little link to PubMed where it has the references, so I can go double check what the AI pulled up. But I thought, think this is pretty cool for us to be able to do. We talked about disease progression and our struggles there. So this is a rather complicated slide, but I just really wanted to mention, because this is hot off the presses, that these things are going to be out there for the future. And so this was basically taking some clinical trial data like MRIs and some physical exam testing, and then trying to use it to predict how people might get worse over time. And so this may allow us to select drugs better. It may allow us to do clinical trials more efficiently. So just more opportunities for us. And then I think another area that is really relevant to the clinic is how do we use AI to help with patient communications. And so again, with our query on the left, back to the migraines, I wrote, can you summarize these options in patient-friendly language in just a few sentences? And so the AI was able to basically translate all of that medical jargon into a nice paragraph that is much more easy to understand for patients, that instead of editing, that whole thing and cutting it down, we can basically just ask the AI to do it, and hopefully it does a good job. Of course, we should still review all of it. So definitely some opportunities there. So the reality is already that not in MS, but in the more broader medical context, these tools have been used enough that patient satisfaction has been assessed. And so this is from some patient inquiries on the electronic medical records, like when you send a message to your doctor asking for some sort of response about, I'm having this symptom, I need this medication or what have you. And so then they had patients grade the quality of the response, and they basically did responses that were generated by the doctors or responses that were generated by the AI. And so the y-axis on these graphs are just how many responses were graded in that category. And then on the left side for each one, it goes from very poor to very good. And so the doctors are in blue and the AI is in green. And the left side panel is for just the quality of the response. And the right side panel is just an important aspect, is was the response empathetic or not? And you can see that in both graphs, the ChatGPT actually performed much better. So patients thought that the responses were of better quality and that they more specifically were better as far as empathy, which I think is really interesting. In addition to patients being happy with AI, this has also improved clinician satisfaction. This is specifically looking at a tool called Abridge, which those of you who have been in our clinic in the last 2 weeks or so may have interacted with. So Abridge is a smartphone application that will basically listen in with your permission on the visit, and it will create a note. So instead of us having to look at the computer every 5 seconds and type things, Abridge will basically listen in, pull out key data, and then put it into a formatted note so that we don't have to focus as much time on clinical documentation. So I think it allows a lot of time for us to not have to spend time typing notes where we just have to edit them, but then also more focus during the appointment on you and not your doctor staring at the computer, which I know nobody likes. So as far as tools specifically for the MS center here, so a lot of you who are my patients have probably seen these reports before, but depending on where you get your MRI, we've started for a few years now using this program called IcoBrain MS. And so that allows us to track brain volume. So we have looked at brain volume as a tool for tracking MS disease for decades, essentially. And so we know that the brain will decline at a certain percentage in volume, unfortunately, for all of us, even if we're perfectly healthy, like once we're over 25 or 30. But in some cases with MS, that decline will be faster. So this can help us. You can see a graphic there where we can track over time what this looks like. And this is set up with AI tools. The other newer one is to look at lesions. So, we know that we are often tracking for new lesions or new injury from MS on the MRI scan. And so this IcoBrain tool can identify lesions with an AI. It can classify them based on the location. And so this is also very helpful potentially for research purposes. But we can also track the lesions over time. And so again, this is something that is still noisy. So this is designed to not miss any lesions. So sometimes it picks up on some things that are not really there, which I think is important. So I basically use this as a check to make sure we're not missing any changes. But this is really helpful for us to be careful about not missing things. I already mentioned a bridge. So again, hot off the presses, this was just implemented in clinic on October 27th. And this is just showing that this data from listening on the phone then gets fed into Epic, which is our medical record, and can create a note that hopefully provides a really nice summary of the visit for everyone. So it has been a helpful tool, I think, for those of us that have used it. So I personally don't use this next tool because I tend to just write my own responses and maybe edit some things from ChatGPT. But Epic does now have our medical record does now have a built-in system that for certain patient messages will draft a response. And then it sends it to us along with the message, and we can basically, click those buttons where it says start with draft or one that says start just with a blank reply. So sometimes this may help just with response times in the clinic. I haven't seen personally really any problems with this. I'm just not sure that I really trust it enough to allow it to save me any time, which is why I'm not using it yet. I don't know if any of my colleagues do. Okay. And I think our last topic is how can AI be implemented to optimize clinical research? Okay. So this is a new study that just came out a couple months ago. This is something that we are extremely interested in doing. So just to provide some background, so for a lot of studies looking at how drugs work in the real world require a lot of manual labor that is not really any different than what we were doing like 40 years ago. It just is on a computer instead of on paper. So for a lot of things where we're saying, hey, let's look at our patients that were on rituximab and how they did clinically, for the last 10 years. A tremendous amount of that assessment, if we're doing that study, is based on doctors, medical students, research coordinators manually reading charts and then filtering that data and putting it into a computer system where it's then aggregated and we can analyze it. So it's extremely inefficient. It's very repetitive as far as looking for keywords or specific data points, and it's something that really makes a lot of sense for a computer tool like AI to do more efficiently. So this is from the UCSF MS Center in San Francisco. This is one of the earlier studies that I think has been really helpful from this standpoint. And this basically allowed really, I think, one person to write an AI program and then validate it with some other folks in order to review hundreds to thousands of charts with the computer system. As you see on the right, look at the language and the wording and then pull out key features and then just basically load that into a database where it could all be analyzed without having to go through thousands of charts, which may take thousands of hours. That this probably was reduced to a few hours of computer processing time once it was set up. So we're really interested in doing this just because we think this type of data processing is super valuable, especially for clinics that have thousands of patients to follow. I think another way that AI has been used is trying to understand, how to repurpose drugs. So probably in the Q&A, we'll have some questions about remyelination therapies, for example. And so there's a lot of drugs that exist that we sort of know how they work. And there's some questions about, can we model with a computer system how that drug, might do with something like myelin as opposed to having to do like a 10-year, 5-year clinical trial to figure that out. And so that's looking at things like pharmacokinetics and pharmacodynamics. It's doing these predictions between the compound, like metformin, for example, and a specific target. And then the AI can include data from genetics, so transcriptomic, proteomic, and then other disease specific features, and try to predict, if a drug might be successful. So it may help us more efficiently select medications to use in clinical studies, which I think is pretty cool. Okay. That was, I think, the sort of the 30,000-foot view of AI. So I want to thank everyone for your attention. Dr. Upchurch and I can answer some more questions during the Q&A. And if you have any other things that come up, like please feel free to shoot me a message.